Okay, so do you want to talk a little bit about what your role is as a pharmacist and what you do at City of Hope?
Sure. So I want to discuss two things. One, what a community pharmacist does and his role, his and her role, and then a role of a clinical pharmacist at the setting that I'm at currently. So a pharmacist in the community setting, our main job is to make sure that all the medications that a patient gets are safe and effective and that they're getting the appropriate dosing. So when a provider writes a prescription for a patient, our job is to look at the drug interactions between the different drugs that the patients are on. So one thing I want to let your students know, I'm sure they have parents or grandparents who are on multiple medications. Each provider writes a different medication, and not all providers might know what the other doctor has written. So our job as a pharmacist to make sure that there is no harm in interactions between the medications, or if the medication is written correctly, or if we can advise the patient to do things that are don't require medications like non-pharmacological therapy, what we call non-pharmacological therapy, that they can use to help with whatever disease state that they have. And also, we make recommendations for things that they can take over the counter that might be cheaper than purchasing a medication that's too expensive, and sort of explain to them how it works in the body and what side effects they may experience and why they may experience those side effects. In a clinic setting where I currently work at, my job is to make sure that when patients are getting their cancer medications, that they're appropriate for the dose is appropriate for their weight, their height, what kind of side effects they may experience. I also look at their labs, discuss the case with the providers, with the physicians, and may make some suggestions and tell them, hey, this dose might be too high for this patient, this dose might be too low, let's make some adjustments. Or I look at their function of their kidneys or liver and tell the doctor these medications need to be adjusted so they don't cause any more side effects. And I also look at the overall regimen to make sure that there's nothing missing if the patient needs other things added on. So that's sort of the role as a pharmacist. Our main job is to look at the medications and the overall picture of the patient and make sure that these are the appropriate medications for the patient. The last thing I want to end it to let students know that uh, again, pharmacists play an integral role in the healthcare system. And, as your students might, I'm sure, have seen when they go to a pharmacy, that maybe the only type of pharmacist they see is the person behind the counter counting pills. And of course, there's a lot more than just counting pills to a pharmacist. But the nice thing too is that there's other fields within the career of pharmacy that students can do. They can again work as consultants. They don't necessarily have to be traditional pharmacists, like working for pharmaceutical companies. They can work for the pharma industry, giving lectures on new medications that are coming out and explaining the clinical importance of those medications. They can also be business owners. They can open up their own pharmacy and run their pharmacy and be a help to the community. And of course, they can also work in hospitals. And a hospital pharmacist is not, again, a traditional pharmacist where they're just handing out medications to patients. Again, they look at the overall picture of the patient and make adjustments to medications or talk to physicians about the overall picture of the patient.